towards the clinical features of leukoplakia. The patients which are more than 40 will have the leukoplakia in their age. Okay, more than 40 years. Okay, average age is basically they have told you about 60 years. Then you have lip vermilion, buccal mucosa, and gingiva, which is 70%. Tongue, lip vermilion, oral floor is 90%. Okay, basically. Now you will study about two type of leukoplakia. There is the thin leukoplakia and thick leukoplakia. In thin leukoplakia, what happened? It is the early or mild lesion, but it is flat and elevated. Means first it will be a flat, then it will be elevated. It is gray white plaques, but that you have might been study in your oral pathology, which is basically white lesions in which you have studied leukoedema. Leukoedema is basically a grayish diffuse a basalt appearance. And translucent fissure wrinkled or folded you have seen in might be in the white spongy nevus. Okay, sharply demarcated borders might be or it can blend gradually disappear like when you elevate the cheek. So in leukoedema it basically disappears. Okay, and continue unchanged in white spongy nevus that even you elevate the cheek but it does not change it. And thick leukoplakia is basically two-thirds of the mild leukoplakia progress. When the leukoplakia reaches two-thirds of mild, so it can considered as a thick or homogeneous leukoplakia. It is thick, distinctly white appearance, leathery to palpation. Very important. The thick leukoplakia is leathery to palpate. Fissures may deepen. The fissures which were actually present in the thin leukoplakia, now it is more deepened and more numerous. Okay. Now you can see it. Well, demarcations. This is so well demarcated. Okay. Now you have studied about the thin mild leukoplakia. Then you have studied about the homogeneous thick leukoplakia. Now it is granular or nodular leukoplakia. Either okay. So the surface irregularities increases with the okay in this. Then you have verrucous or versiform leukoplakia, which is sharp blunt projections. In proliferative verrucous leukoplakia, you will see the multiple carotid plaques with the rough surfaces. Okay, it is slowly growing, present in gingiva, and having this proliferative verrucous leukoplakia has transformation to squamous cell carcinoma after 8 years. And erythroplakia, which is a scattered patches of red, but it is atrophic epithelial cells. How can you remember that it has a atrophic? It is red, means the epithelium is now atrophic, and the connective tissue and blood vessels can be seen. So it is it gives the red appearance. Okay, speckled or erythroplakia, which is the intermix of red and white. You can see it here in the intermix of red and white, basically. Okay, and this can be in white, red and white. Look at this is the red and white leukoplakia. How can you make diagnosis? Okay, so diagnosis is very important for this. When you see a biopsy, when you see a white lesion and it has been 2 weeks, so you will prescribe the patient. They do immediately the biopsy. Why we do biopsy? It is for the clinical suspicion of the erythroplakia, which is mandatory. How will to exclude the recognized diseases means if I consider it is submucous fibrosis, lichen planus, so I can exclude that diseases for this. And also to see that there is dysplasia is present or not, or if dysplasia is present, so which grade of dysplasia is this, mild, moderate, or severe? Which grade of dysplasia is this now? Okay, then if you have prescribed the patient the treatment, so after the first visit, means after 2 weeks of the first visit, that if you have considered it is a candidiasis, so you have might prescribe the brushing technique to that. Or if the patient was smoking and you have tell them cessation, so might there be any difference? But if there was no difference, so you will tell the patient after 2 weeks they do the um, biopsy. Okay, but you have to wait for 2 weeks to see that to assess your clinical response to the initial treatment which you have given to the patient. Okay, the biopsy might be incisional, excisional, single, multiple, and maybe under local and general anesthesia, but it depends on the number, type, and the site of biopsy also. We have studied many biopsies are present: incisional, excisional, single, multiple, but it is done either local or general anesthesia, and depending the number, sided type of biopsy which you will take. Now, biopsy is taken either from symptomatic area, means the symptoms which are showing, or either asymptomatic, then from red or indurated, means if they the means it has no symptoms but it is red and it is hard. Indurated means hard. The presence of dysplasia, carcinoma in situ, yeah, invasive carcinoma cannot be protected clinically. So either it is a dysplasia, you cannot see that white patch and you will say, oh, this is dysplasia or not. Okay, so you have to do biopsy for this. Okay.